Hi, everybody. It's Kathy Ann with Deception Healthcare in America with Kathy Ann and Jennifer. And Jennifer couldn't be with us today, but I want to do a podcast on thoracic outlet syndrome because July is Thoracic Outlet Syndrome Month, and I have thoracic outlet syndrome. So, thoracic outlet syndrome, and this is defined by the Mayo Clinic and Cleveland Clinic, it's a group of conditions where there is compression on the nerves and blood vessels from your neck to your shoulders to your upper chest. So, that means your neck muscles, scalenes, and through your clavicle, pec muscle, scapula. So, according to my doctor, the most reported pain is scapula pain. And I can attest to you that that was some of my worst pain, burning scapula. So there's 3 types of thoracic outlet syndrome. There's neurogenic, that's compression of the nerves. That's the one I have. There's arterial, that's compression of the subclavian artery. And then there's venous, that's compression of the subclavian vein. So when you have the arterial or venous ones, that can be deadly because it can cause a blood clot, which can kill you. So people who have those 2 may have discoloration in their hand and their arm. It may turn like purple because they have a blood clot. People with arterial and venous can also have neurogenic because if your arteries or veins are being compressed, chances are your nerves are being compressed as well. So there's a lot of reasons one can have thoracic outlet syndrome. It could be genetic anomalies. You may have cervical ribs. You may have fibrous bands. You may have enlarged scalenes. Whiplash is one of the most common ways to get thoracic outlet syndrome. Repetitive motion, like a pitcher or a tennis player who just throws or hits with one arm continuously. You can have thoracic outlet syndrome on one side of your body, left or right, or you could have it on both sides of your body. Mine is on the left side. It's only left. I have no symptoms on my right side. So some of the symptoms that those of us with thoracic outlet syndrome have are you can have some, you can have all, you can have a few. It varies widely. Actually, it confuses a lot of doctors. Occipital headaches. They're so bad. Again, mine's only left side, so I get these headaches behind my eye and sometimes on the side of my face. Neck pain. One of mine is neck pain. Pain along clavicle into like your coracoid process. I did mistake mine for a heart attack and I went to urgent care and had a chest x-ray. You're not having a heart attack. We think it's psychological is what the guy told me. But I also had a heavy arm, left arm, and that's another symptom is having a heavy or a fatigued arm. So just think you have a fatigued arm with chest pain. Those are heart attack symptoms, right? Pain in your arm. You can have pain in your bicep, your forearm, wrist, numbness in your hands, tingling in your fingers. And, that can be mistaken for like carpal tunnel syndrome. Other symptoms can include ear pain, jaw pain, trouble swallowing, vision problems. And I've experienced ear pain. And in the beginning, the doctors would look at my ear and say, you don't have an ear infection. I said, I know, I think it's coming from my neck. And they said, impossible. But it's not impossible. It's possible and probable. Jaw pain, I get jaw pain. And they'll say, oh, TMJ. Well, someone like me who was injured by a chiropractor, I was injured by a chiropractor, and that's how I got whiplash. Never had TMJ pain before. And all of a sudden I have all this jaw pain. And it's probably because the tightness in my neck and it's all connected in here. And even my voice is scratchy. I think that like my muscles are pushing into my voice box, but I don't really know. So, and I did experience vision problems after my whiplash. I had traumatic iritis in both eyes. I lost vision in one eye, and I ended up seeing a neuro eye doctor and went through a program, and my eye is much better now. And I had an enlarged pupil, and it looked like my eye was droopy. And as you can see, it's I'm pretty normal now. So these are a lot of the symptoms that people have, and they can be mistaken for other things. Like I said, like carpal tunnel syndrome. I went to one orthopedic doctor and he goes, look, people get neck pain. It comes and it goes. And then he shoves some exercises in my face. And he really did a disservice because I went in there complaining that I was injured by a chiropractor, and he belittled me and tried to tell me, hey, look, everybody gets neck pain. But you know what? Not me. There was an occurrence that happened. Actually, he sent me to a pain management doctor who probably was one of the better doctors. At least he was willing to listen to me and work with me. So, thoracic outlet syndrome, it's pretty rare. Arterial and venous are the rarest. Neurogenic occurs about 1 in 34,000-ish people. The incident, it could be more. A lot of people are misdiagnosed. So that number is probably wrong. They say people with thoracic outlet syndrome see about 7 or 8 doctors before they get a accurate diagnosis of thoracic outlet syndrome. You're lucky if you get less than that, but a lot of us probably see a lot more doctors. I saw a lot. I saw at least 4 neurologists, and it's funny because the neurologists will say, go see a psychiatrist, and then I saw about 3, it could have been 4 orthopedic doctors, and the orthopedic doctors said, you need to see a neurologist because we can't help you. And the neurologists say, oh, we think it's all in your head. You need to go see a psychiatrist. And you just get passed around. Actually, I saw a neurologist who said I needed to see a gastrointestinal doctor. And I'm like, what? Gastrointestinal doctor for neck pain and scapula pain? I mean, the way some of these doctors don't want to do their due diligence and think for a second and just pass you off because you're a harder case. If you have migraines, here's a medicine. You have neck pain, here's an exercise. But if you go in with a bunch of symptoms and you stump them, then you're either crazy or they're not the guy. I saw an orthopedic doctor, and this is true. She had me walk across the room and walk back. And after I did that, she goes, good news. There's nothing wrong with you. And she came to that determination just from watching me walk across the room. Now, is that crazy or what? So I've seen physical medicine doctors, sports medicine doctors. So I saw far more than 7 or 8 doctors. And newsflash, my brother is a doctor too. So the person that thought I might have thoracic outlet syndrome was my PCP, who sent me to a vascular doctor. And that is the doctor you should be seeing, is a vascular doctor. I saw the vascular doctor and he diagnosed me with the neurogenic thoracic outlet syndrome. Actually, he said I'm a classic case. And so with that information, I went back to some of my other doctors and I said I was diagnosed with neurogenic thoracic outlet syndrome. Well, guess what? They didn't believe that. One of my doctors, was so adamant about me not having it. He referred me to another vascular doctor from his college. And I saw her, and she also diagnosed me with neurogenic thoracic outlet syndrome. And by now, 2.5 years have passed. People believe that I have thoracic outlet syndrome. When you see the vascular doctor, not the day of your appointment now, but they'll send you for an injection. It's some kind of lidocaine injection. They inject it into your scalenes and your pec muscle. And if your symptoms improve or go away, then that's how they diagnose you. They also will send you to physical therapy. And I did about 8 to 9 months in physical therapy. For those of us with thoracic outlet syndrome, physical therapy usually doesn't work for us. They send you there because they see if it's bad posture or that you have weak muscles. And so I, along with many other people, did not get improvement from physical therapy. I appreciated my physical therapist. They really listened and tried to help, but physical therapy was a trigger and made things worse. And so I also saw a postural doctor. Really great. I do recommend that. So there were things wrong with my posture. I didn't have horrible posture, but I became more aware of how I stood, how I oriented myself in the world, and I still do her exercises that she prescribed me. So the doctor you should be seeing is a vascular surgeon. A lot of times we get these MRIs and nothing shows up on them. They're like, there's nothing there, you know? And I mean, something's there, right? I mean, something's wrong. So a lot of us get told that we're crazy, or we're a hypochondriac, or we're manifesting this in our head, and they try to put us on antidepressants or see a psychiatrist. And that did happen with me. And there's nothing wrong with my mind. I'm not a hypochondriac. I did a psych evaluation actually, and they didn't find anything wrong with me. The problem is our healthcare system, and we have doctors who are ignorant, incompetent, and don't want to do their job. And that's what it all comes down to, is they can't figure it out. So they gaslight you and they say, you know what, we can't see what's wrong with you, so you're the problem. And I take great offense to that. And it's part of the reason why I do the podcast, is because I'm so offended by this. So you see a vascular surgeon and you do the lidocaine injections and everything works out. So for me, I was offered surgery by both vascular surgeons, and I turned them both down. And after you turn down surgery, the doctors don't want anything to do with you. They don't want to help you find the root cause or work with you to relieve your pain. They just want to perform the surgery. Well, the surgery doesn't have very good outcome. So a lot of people, some people do experience relief. Some people, their pain is worse. Some people experience relief and then their pain comes back because scar tissue forms where they remove their first rib or scalene, so they get scar tissue in its place and their pain comes back. The prognosis is not good for the surgery. Now, we can argue about this, and people who've had the surgery might argue, but what I'm looking for is the root cause. These symptoms, the headaches, the neck pain, the clavicle pain, the scapula pain, those are all symptoms of something else. So the surgery, they remove one of your scalene muscles, release your pec, and remove the first rib. And I think it's in the hopes of that they will release the compression somewhere along these lines. But you just can't open somebody up and start cutting people's body parts out in the hopes that you're going to relieve compression. Tell me where the compression is. Tell me what's wrong. I was normal before. I have whiplash. So tell me why I'm having these symptoms. And if you can tell me that surgery will alleviate and cure this, I will strongly consider it. But if you just want to cut me open because that's just what you've always done for people who have thoracic outlet syndrome, we're all different. And maybe one surgery worked for somebody else. But if you don't find out what the root cause is, where the compression is, why are you having this, then what's the point? So I've turned down surgery. I turned down pain medication because my pain can be bad, but I'm supposed to feel, and I don't want to be on pain medicine, and I understand that. some of our pain feels deadly. It's hard to explain. It's like explaining the pain of giving birth. You can't unless you experience it. It's so horrible. But some of the things that I've done and my fellow sufferers done, we've done things like acupuncture. I find acupuncture didn't help me at all. Maybe somebody else will. Shockwave therapy to help get rid of scar tissue. Massage, medical massage. I find that helps. I highly recommend massage, medical massage, because these people, they touch people all day long. So they know what muscles and stuff are supposed to feel like. And they'll work on you, I guess, 45 minutes. And they'll tell you, oh, your shoulder's hiked. Or, oh, your pec muscle's so tight. Or, oh, your neck muscles are so tight. And they give you all this feedback. And you can go back to a doctor who will listen. Hopefully you found one that could listen. And you can go back and you can start putting the pieces together. Okay, well, I have a shoulder hike. Okay, well, let's try to what can we do to bring that shoulder down? Oh, your pec muscle's tight. What can we do to loosen things up? Oh, your neck is super tight. What can we do? Now, my complaint is I do stretches every single day, targeted stretches, and I just can't get these muscles to calm down. There's just something about me that these muscles won't calm down or untighten. But I will tell you something, is I do a lot of research and adhesions. So I stumbled onto adhesions. Adhesions is a glue-like substance your body secretes. So for instance, I had a neck injury. So let's say that in trying to repair the injury, my body secreted this glue-like substance in my neck for the injury. But when the injury is healed, the adhesion doesn't go away. It stays. So let's say that I have an adhesion on my neck and the glue-like substance, in its effort to heal, it also encased my nerves. So now my nerves are encased in that adhesion, and that's what's causing my referred pain and symptoms. It's my theory. So my massage therapist found the adhesion on my neck. She said it felt like a piece of steak fat. So I went and found another doctor who does soft tissue therapy, and I went to him. And guess what? He found the adhesion too. He actually found a couple more adhesions as well. But he found the one that is causing my neck pain. And he's like, yeah, that's an adhesion. So he's been working my adhesion out and my other pain areas, as well as my massage therapist. And I'm actually going to see an adhesion specialist next month in August. And I hope I'm on the right path. I hope the adhesion is the root cause. I don't know. I have gotten so much relief after seeing my massage therapist and the soft tissue therapist that I hope that I'm on the right path. I've also gotten Botox as well, and I had 3 weeks of relief from Botox. And if I didn't think Botox was so dangerous, I would just keep getting. Oh, it's expensive too. I paid $1,300 for it. I mean, there's a lot of things you can do if you opt out of surgery. There's pain meds. There's alternative therapies like massage therapy. I stretch and exercise every single day. I go for 2 walks a day. I'm on the anti-inflammatory diet. I do low carb, so I keep my weight down. And things like seed oils cause inflammation. Other foods I noticed ramp up my symptoms. Caffeine causes my headaches to be of epic proportions. So once I cut out caffeine, my symptoms came down. I don't drink any kind of dairy. I never really did, but I noticed sometimes I want something creamy, so I'll have a glass of milk. Oh, I found that milk made me feel horribly sick. These are things that you'll have to explore on your own and use yourself as a guinea pig to figure out what ramps up my symptoms, what causes my symptoms to go down. And sleep. You have to get a good night's sleep. I used to be on melatonin because I could not sleep because of my burning pain. And now I take magnesium glycinate and a vitamin D before bed. And I've been sleeping a lot better and don't need melatonin. But I just wanted to bring awareness to thoracic outlet syndrome. July, thoracic outlet syndrome month. It's a syndrome that people don't understand. Doctors don't understand. It's confusing. It overlaps with so many other conditions. And what you need is a vascular surgeon to give you the proper diagnosis. And if you can get the proper diagnosis and make sense of all your symptoms, which getting a diagnosis helps you make sense out of everything, you can start chipping away and working on yourself, trying to get better. And it's really hard because I understand the pain and it's debilitating and it just seems like your life is over sometimes, and it's really sad. But I hope that everyone can get the help they need, get proper diagnosis, and I hope that our healthcare system will quit telling patients that this is all in their head and to seek psychiatric help when there is something very wrong with them. So thank you guys so much for listening to my podcast about thoracic outlet syndrome. I hope that you've learned something, and I hope that I was able to help somebody. Bye-bye.